Hello, everyone, and welcome, and thank you for tuning in to Health Leaders, the place for peer sourced and solution focused insights for healthcare executives. My name is G. Hatfield, and I'm the CNO editor for Health Leaders. Today, we are speaking with Dr. Yolanda VanRiel, who is the Department Chair of Nursing at North Carolina Central University, about international recruiting in nursing. So, hi, Yolanda, how are you?
Good. How are you doing?
I'm doing well. Thanks for taking the time to be here today.
Thank you as well.
Yeah, so let's jump right into it. Obviously, we're in the middle of a workforce shortage, and CNOs and other nurse leaders are scrambling to find recruitment and retention solutions, and one of those is potentially international recruiting. So I wanted to ask you, what are the benefits of recruiting nurses internationally, and how does that help address those workforce gaps?
Okay. So thank you for this question. So one of the ways that helping with the international nurses, they do
Hmm.
feel, as you know, we're in a nursing shortage.
Hmm.
So they definitely will feel the critical staffing gaps. And also it enhances diversity in the workplace, workplace too, as well,
Hmm.
because they're nurses from different countries. They bring unique cultural perspectives that can
Hmm.
improve the care for diverse populations. Also, it might be that, they might bring a different viewpoint, a different healthcare perspective or
Hmm.
approach, and it might lead to some new ideas, practices, or inefficiencies in patient care as well. But definitely, when you're looking at also long term care, and other healthcare settings where there is a shortage, it's definitely very helpful to have nurses from internationally.
Hmm. Absolutely. Yeah. I like your point about it increasing diversity in the workforce because obviously it leads to better patient outcomes. We know that. So,
Exactly. And then also a lot of these international nurses, they'll go into areas that are underserved, such as rural areas.
mm,
Whereas, our new nurses, they get graduated and they're like, okay, they want to go straight to the big city areas. They can also help in those rural areas as well.
hmm absolutely. So, kind of on the flip side, are there any pitfalls to international recruiting?
Well, yeah, this is going to bring some pitfalls and challenges.
Hmm.
One of those can be where we don't want to definitely what they call brain drain, a
Hmm.
phenomenon where, we have those highly skilled nurses from the lower income countries that come to wealthier nations. And so we don't want to leave that home country where they're also in a staffing shortage.
Hmm.
And so to deal with that, there has been a policy that by the World Health Organization,
Hmm.
Global Code of Practice on International Recruitment of Health Personnel, and that helps minimize in those countries that we would affect. But
Hmm.
also, there's credentialing and licensing challenges. It might be that they might not get their license in time, so it takes a while to get that.
Hmm.
Also, and then also, if they're coming here, maybe they didn't have some education that we offer here, and so they
Hmm.
might have to go and, like, for instance, we had a student who come from a different country and they didn't have as much peds and maternity. So she did her peds and maternity here, and then she
Hmm.
was able to sit for the NCLEX exam. So all of that can bring challenges, as well as there might be some cultural challenges as well and
Hmm.
language barriers. So you might see all of that as well.
Absolutely, yeah. And you mentioned students, and I want to ask you from the perspective of an educator. How can health systems foster partnerships with international organizations and those educational institutions to help create those pipelines into the nursing industry?
So what they can do is definitely you can contact those institutions
Hmm.
and come up with a training program, a customized training program. It might be that you say, okay, you can bring your students here for a little while, or we can bring faculty members there. There's all sorts of ways that you can develop those partnerships. And I
Hmm.
think that's one of the things that actually might be a good way to do it because then you're influencing help influence what's being taught there and
Hmm.
bringing that so when they come here, it won't be as hard for them because they'll have this already program where they're getting some of those P's or maternity or some of those
Mhm.
other programs that you wouldn't think that that they need to have here to be working in the States. So I would think that would be good. I
Mhm.
think, partner with also our academic partnerships here as well in the United States as well will help out. But I know that some of the systems do like mission trips. And
Mm.
so partnering with, like aligning with, like if you have a Office of International Affairs, there might be
Mm.
someone who can line you with these programs as well. So I think
Mhm.
that's one of the good things that we're starting to actually look at as more as like getting students to get that global experience.
Mhm. Absolutely. And just for out of my own curiosity, what are some of the common differences that you see in training from students, local students in the United States versus throughout the rest of the world?
So from what I've seen lately, is definitely the biggest one is probably maternity and peds
Hmm.
content. At
Hmm.
least this is from the one student that we had. It could be, other areas, maybe mental health,
Hmm.
also could be one, a lot of those specialties that you might not see
Hmm.
as much of. But I think partnering with school in the States will be perfect to get that. And so I see that happening a lot more, which is really good that schools are starting to do that.
Hmm. Absolutely. So we've kind of touched on it a little bit, but how can CNOs help balance recruiting from their own local communities with international recruiting? Because obviously, you want to have that healthy balance between the two.
Exactly. So that could be a multifaceted strategy,
Hmm.
which includes, developing a local talent pipeline, adhering
Hmm.
to those ethical recruitment practices that I discussed earlier,
Hmm.
fostering diversity and inclusion, and you got to strategically plan for both the short term and long term workforce needs. So I
Hmm.
think by maintaining a healthy balance between local universities or international recruitment, that health systems can build a sustainable, diverse and skilled workforce.
Hmm. Absolutely. And then you mentioned it earlier as well with the guidance from the World Health Organization about international recruiting. But how can health systems specifically make sure to not have that negative impact on the global communities that they're pulling nurses from?
So I would think that they can basically adhere to those same discussions as far as following that policy, collaborating with educational partnerships back in those countries, because
Hmm.
I do know that with talking with CNOs that this doesn't happen right away. So it
Hmm.
takes time. And so one of the things they can do is look at doing cross-cultural communication workshops. Is there a
Hmm.
particular country that they're looking to get nurses from? Partner with that, find a pipeline so you can discuss that needs with not only their universities, but also I'm thinking including the hospitals as well,
Hmm.
because of you're not competing. Everybody is actually feeling the pinch with staffing. And so I think, probably talking with that other healthcare system is probably one of the best things you can do to establish
Hmm.
that relationship.
Absolutely. Yeah, it's all about communication.
Mhm.
Yeah, absolutely. Well, thank you so much, Yolanda, for your time. I'm really grateful to have had this opportunity to hear your insights. And thank you so much to our audience for listening.
Thank you, and you have a great day.
You too. Thank you.